Welcome to HealthWise, the locally produced medical program for the Charlotte area. Our show tonight is called Preparing Your Child for Anesthesia. Sending children to surgery can be an unsettling experience for patients and parents. We hope the next hour will answer questions to help ease minds when it comes to children and surgery. The medical team this week comes from Southeast Anesthesiology Consultants. Welcome to HealthWise, Dr. Brent Holway, Dr. Barry Stowe, and Dr. Richard Evack. We also welcome your questions during the broadcast. The number to dial, 704-371-8895. Welcome, gentlemen.
Thank you. Thanks for having us.
Before we went on the air, I said that this is a topic that I've been waiting to discuss with you. I do not have children, but I have many nieces and nephews, and I can remember as a child having tonsils out, and just the thought of going to the hospital and being put under was very scary for me. You see this every day. What's the bottom line message to parents and to those little ones?
It is very frightening for families, and we appreciate how difficult it is. And at the same time, the more they can learn about anesthesia and what they're going to go through allows them to prepare their children and it makes it easier for them and easier for us.
Education is a real top priority.
Correct. I think the more parents, and especially parents teaching their children about what to expect, really helps alleviate the children's anxiety when they come to the hospital. If the parents can take a little time to talk to them about things ahead of time, it really helps things out in the long run.
Dr. Evack, and then once they do get there, you, the doctor, you help put that child at ease before he's actually or she's put to sleep?
We do. We try to build a rapport with the children, and we also have child life specialists that help us build rapport with the children in the preoperative area. The other thing we use after that is we use preoperative medications to relax the children prior to surgery.
Okay, all three of you look like if you couldn't be dads, you could be a favorite uncle. So for you to even get into this profession, you must have had a love for children.
Absolutely. I studied pediatrics before I went into anesthesia, and it's been a focus of mine for my entire career.
Dr. Stowe, you want to expand upon that?
Yeah, I think all of us that practice pediatric anesthesia in our group really love to work with children, and there's a unique set of responsibilities and characteristics that go into making a pediatric anesthesiologist.
Now, what is anesthesiology? Let's just pick it up from the very top. Dr. Evack, you're first.
Anesthesia is the practice of medicine that deals with making people insensible to pain when they're asleep for surgery, and we also work with patients to make sure that they are safe during the procedure.
How does that work?
Well, you know, I like to explain it to families as kind of a continuum of sedation, and just to build a paradigm for people. If you give somebody Valium, that's minimal sedation. And when people go and they have like a colonoscopy or a procedure similar to that, they mix benzodiazepines with narcotics, and that's moderate sedation. But people are breathing on their own, and they may move around, and that's okay. It doesn't affect the procedure at all. But because the medicines are heavy sedatives, people fall asleep. They sometimes think that it's general anesthesia, but it's not. You give additional medications, people are more deeply sedated, where it takes quite a bit of stimulation to get them to respond. And eventually you give other medications, and it's general anesthesia. People don't respond to anything, including surgical stimulation. So it's a continuum of sedation.
Right. So there's a path there, Dr. Stowe.
Correct. We practice in the more deeper forms of anesthesia. The deep sedation on up until general anesthesia, where the patient becomes completely unconscious, may or may not stop breathing. And that's where our expertise comes into play, because we're used to dealing with that on a day-to-day, minute-by-minute basis.
Okay, let's go ahead and get all of this out in case there's folks that out there are a little confused. Are you guys medical doctors?
Yes.
Okay, all three of you are MDs, and this is a specialty.
Yes.
Okay, so when it's your job in that OR to put these patients to sleep, there are other doctors in there who are actually doing the procedure for whatever reason that child or that patient is in there for?
Yes, I mean, we work with a lot of dedicated professionals in a variety of roles taking care of the patients. There are certified nurse anesthetists, there are nurses, the surgeons, scrub techs, there's a nurse that's a circulating nurse. There are lots of people involved in this process. It takes a lot of people to take care of patients when they're having surgery.
It's a team. It's a team approach. And when you actually go into this education with the parents and with the child, is that all part of that? Because I would think that would make me feel better to know that there is a team of people in there with your little one.
You know, and everyone introduces themselves and, you know, tries to describe the role and how they'll play a part in taking care of the patient.
All right. And so you are, during that whole procedure, it's your job to pay strict attention to this patient. Kind of go over that with me. Here the patient has been put to sleep. Tell me what happens next, Dr. Evac.
I think I'd like to backtrack just a little bit, Joey.
Sure.
I mean, part of our job in taking care of the patient totally is to evaluate them first preoperatively, to see what other medical conditions they have, and to choose an anesthetic that's appropriate for that patient. And also preoperatively to make sure they're in the best, for an elective surgery, make sure they're in the best or optimal shape medically before they undergo an elective surgical procedure.
Right.
So that's the first thing we do. So, you know, as medical doctors, we have to assess that. You know, sometimes we need other tests or consults or examinations prior to that to make sure the patient's safe.
Okay, so for instance, to make sure that their heart's in good condition, their lungs are clear, is that what we're talking about here?
Pretty much. And a common, for children commonly, you know, a common question we get is, you know, my child had a cold recently.
Yes.
And we want to make sure that he's not in the acute phase of that infectious period where he's going to have problems with his lungs for an elective procedure. That'd be a common example. So from there, we choose a method of anesthesia to put the child to sleep. Commonly, you know, we will build rapport with them, as we talked about preoperatively, and use medications depending on the age of the child, either intranasally, intraorally, or sometimes intramuscularly to relax them before they go into the operating room. Most younger children will go to sleep with an anesthetic mask. Older children sometimes will start an IV, as we do with an adult. So using one of those techniques, we'll put the child to sleep. We'll monitor them closely using our routine monitors, which are EKG to watch their heart, a blood pressure cuff, a little monitor on their finger or toe called a pulse oximeter that watches the oxygen saturation of their blood during the entire procedure, and those are on through the entire procedure and actually into the recovery period. We make sure that the patient, the child, stays asleep for the surgical procedure. We make sure that they have some pain medicine already delivered in their body through an intravenous, which if we put them to sleep with a mask, we start an intravenous after they're asleep. So we need to give them anesthetic medications, pain medications, and other medicines to keep them asleep. More complicated surgeries, there are, you know, other monitoring devices we use. And we're in constant communication with the surgeon during the procedure until its end. And then we let them awaken, take them to the recovery room.